My name is Simon Goldman. I manage the life sciences side of the UCL Technology Fund. It's a £50 million fund specifically for University College London and collaborators. So we're very, very integrated with the university, and that's really important in terms of that, how we operate on a day-to-day basis. So we're there, which is very important, I think, for academics. Particularly, a lot of them don't have experience of commercialisation. Many do, but also, we're present. We can help them think about commercialisation even before we actually engage with them on a particular project. So a lot of what we do is just literally listening, helping support people in terms of just thinking about how they might, for example, bring a particular product into the clinic, helping them to think about the best forms of funding, because there's lots of different forms of funding out there. Ours is one type that can go alongside other forms of funding to help them achieve that goal. And very often we'll meet people years before they have an idea, and to us it's very important to engage at quite an early stage, but it's right through the whole spectrum. So we'll be talking to people right at the discovery stage, right through to clinical trials. The thing that's really important for us, though, is that it's translational science. Some of the stuff that we see already has a patent associated with it. Some of the stuff that we are looking at is pre-patent, and indeed, actually, in the advanced therapies area, a lot of the things that are being commercialised at the moment don't have any patents around them. It's the clinical data that's really important in terms of a commercial proposition, as opposed to having an actual patented position. We're looking for things where there's going to be global impact, and that's very important to us. So we're a fund that's designed to make a commercial return for our investors and a return for the university. So the returns on the fund are actually shared with UCL. That's very important to us as well. So we're looking to drive both a commercial return and see science that is going to be impactful in the world. I think one of the great things about UCL is the infrastructure that's available, and I think that's what makes a fund like this work for a single institution. It's quite an unusual kind of structure. So UCL has several major hospitals associated with it, so Moorfields Eye Hospital, Great Ormond Street Hospital, the Royal Free, UCL Hospital, and so access to patients, particularly in the context of gene therapy and cell therapy, is hugely important in terms of commercialisation. One of the biggest risks in terms of commercialising an advanced therapy is that you can't get access to patients. So being a major centre in the UK, indeed in Europe, and indeed globally, in terms of that patient access, I think is hugely important. UCL also has access to GMP infrastructure, which is fairly unique among, I guess, academic institutions globally as well. So that infrastructure is something that we can work very closely with. A particular clinician may have 5 patients with a particular disease. It's an environment where you can take a capsid from over here, a promoter sequence from somebody over there, cobble it together, and hey presto, not only have you produced something that's now in patients and curing them, but is also something that could actually be commercialised as well. And so what's very important to do that is a manufacturing process that enables that. So, for example, being able to freeze a patient's cells, to fly them over to a central facility, do the cell processing, and then send it back, just means that these patients who are often extremely ill, people with immunodeficiencies, for example, may not be able to travel. And so by coming up with a process that can then be applied globally really means that not only has the idea, which started at UCL, it can be rolled out for many different diseases, and it can be rolled out globally. And the academics have really taken that on and really stepped into that role within the spin out to make that happen. So I think in the UK, in terms of advanced therapy research, I think we're seeing a lot of stuff on, in terms of CRISPR, gene editing. My general sense is that will come. I don't think it will come tomorrow. I think there's very much a sense that it's being tried out. But I think in the next, say, 3 to 7 years, I think it's very much going to be those workhorse AAV and lentiviral gene therapies, which will be delivering real cures to patients because we know they work now. And that's been just a fantastic revolution in the last 2 to 5 years. And so I think in the next 2 to 5 years, it's very likely that will continue. A little bit down the track in cell therapy, I think we probably will see more sophisticated CAR T therapies, for example, using logic circuits targeting neoantigens with big bioinformatics capabilities behind it. I think over the next few years, it's just fantastic to see that we can cure cancer and we can cure these rare diseases, and we actually have the tools to do that right now, and I think that that's going to continue.